Instruments. On this video, we are going to speak and talk about instruments demonstrated. So you'll get a set of 4 basic suturing instruments. These include the toothed forceps. As you can see, you need to hold it with your thumb, index and middle finger as well, and that's you use pressure to hold, and once you release pressure, it opens automatically. Next one is the non-toothed forceps. Again, it's very similar way to hold it and to manipulate tissue. Again, thumb and index with the middle finger as well, just for a little bit more control. And again, you press to hold, and when you want to release, you just release pressure. Third and more complex is the needle holder. This is very important for any suturing, of course. And as you can see, it has different parts from the end, which it holds a needle, hinge in the middle, and then more proximally there is a clip. The needle holder needs to be held with the tip of the ring finger and the tip of the thumb. So that's the correct way. Middle finger goes outside the needle holder, and the index finger is on the hinge, just to give it a little bit of stability when you are using it. Again, the needle holder movement is semicircular movement, and the movement comes from the wrist. Now, the needle holder has a clip to keep it shut, so all you need to do is just press it together, and then the teeth are shut so it doesn't open accidentally. And again, to close it, to open it, you just need to press the both sides of the clasp in perpendicular direction. So again, you need to press them towards each other and away on the different plane. So that's to close, you press them together, and to open it, you need to be careful that you don't put it towards the end of your finger, otherwise it's difficult to control. If it slips more inside, you don't have much control to open and close. It's much more difficult. You just need to be on the tip of your ring and thumb. And again, you hold it correctly. Next are scissors. And again, scissors are held similar to a needle holder between the ring finger tip and the thumb tip. Middle finger can go outside, and the index finger is on the hinge, just to give you a little bit more stability and more steadiness when you are cutting. These are the basic instrument. At the end, once you finish, you need to clean it with a cleanel or similar wipe, and then you can use 2 pieces of tissue paper, close the needle holder, put the scissors so it's pointing the same direction closed, and both forceps together, again pointing the same direction, and then fold the tissue paper as you can see, just to give it a little bit of more padding and to stop the pointy ends from causing harm. And that's how you need to leave it. Instruments, continuing now, how to use a needle holder correctly. As we mentioned before, the needle holder has different parts. You need to hold it first correctly between the ring and thumb finger, and we will use the toothed forceps to manipulate the needle. Now, if you look to the needle, it's semicircular, and we need to hold it between the 1/3 towards the suture material and 2/3 towards the tip. And that is the correct place where we need to hold the needle. Now, if you look to this is the teeth of the needle holder. We need to make sure that we don't hold the needle too close to the hinge, but actually the needle needs to be towards the tip of the needle holder. And that's how it should be held. That's where the place that it should be held. So it should be towards the tip, not towards the end. Now, if you look to the needle, this should not be at a lot of angle like this, because otherwise it would be difficult to control the needle when you are doing suturing. So it should be an angle. If anything, in this plane, the needle should be perpendicular to the needle holder. As you can see, in this plane, it should be at the tip of the needle holder, not towards the hinge. And in this plane, it should be between 1/3 and 2/3 junction of the needle, and that's the correct place. Once you have this, you have your ring and thumb finger, middle finger, and tip of the index over the hinge, and use a semicircular movement to suture, and that's how the movement is going. Now, once you finish, you should not leave the needle with pointing out like this, otherwise it can cause damage. So if you look at this, you need to hold the needle from its end perpendicular to the needle in a way that the needle tip should be pointing towards the needle holder itself. So it's a safe area. So if you look at this, there is no pointy parts or no sharp ends pointing out. And if you need the needle holder like this is safe. And as you can see, you can just then hand it over like this to the nurse, or you put it on the side until you use it again. And this means that the needle will not cause any sharp injury, and it will not go through unnecessarily tissues. Once you've done this, you can leave the needle holder or you can hand it over to the scrub nurse.